I gave my patient spinal anesthesia for TURP surgery, but the level has not been achieved when I checked after 10 minutes. After 15 minutes, still the same. The level has not been achieved. So what should we do? Well, surgery has yet not started. If there is no effect of the spinal at any spinal level, there is no effect, we can repeat the spinal anesthesia again with the full dose, what we have given earlier. But if there is a patchy effect or if adequate level of effect is not there, it would be very risky to give spinal again. In this case, there are two things which we can do. We can give epidural, we can put an epidural catheter and supplement the dose of local anesthetic with epidural catheter and achieve the required concentration, achieve the required level. Or what we can do is give general anesthesia to our patient. So this is how we manage a failed or inadequate spinal anesthesia. For more such information, log in with Dr. Swati in Learn Anaesthesia app.